Statistics show a meteoric rise in the adoption of telehealth services, a trend further accelerated by global events that pushed us towards more remote, digital solutions. It's not just about convenience, it's about creating a healthcare system that's more accessible, more responsive, and yes, more human. But what does this surge in telehealth mean for patients and healthcare providers? Welcome to Medical Money Matters, the podcast where you can find experts, answers, and resources so that you can achieve mastery over the financial and business aspects of your practice. Hello, everyone. I'm your host, Jill Arena. I began my career in accounting and finance, and I have more than 30 years of experience running medical groups. I own and operate a national healthcare consulting and revenue cycle company, and I am the author of Physician Heal Thy Financial Self. In 2020, I co-founded the Physician Leadership Project, and my passion is to increase financial and business literacy for physicians. Episode 65. The Doctor Will See You Now Online. The Telehealth Revolution and Reimbursement Challenges. Hello, and welcome to another episode of the Medical Money Matters podcast, where we delve into the financial pulse of the healthcare world. Today we're embarking on a digital journey into the realm of telehealth. Our focus? To understand the telehealth revolution and the intricate maze of reimbursement challenges. The concept of a doctor's visit has been redefined, largely by the pandemic. No longer confined to the four walls of a clinic, healthcare has transcended physical boundaries thanks to telehealth and virtual visits. But how did we get here? It's a story of technology meeting necessity, a narrative of innovation that's reshaping healthcare delivery. The evolution of telehealth isn't just a tale of recent advancements. It's a journey that began with simple telephone consultations, gradually embracing more sophisticated technology. Today, virtual visits encompass a spectrum of services, from video consultations to remote patient monitoring. Telehealth is bringing healthcare to the fingertips of millions. And the numbers? They speak volumes. Statistics show a meteoric rise in the adoption of telehealth services, a trend further accelerated by global events that pushed us towards more remote, digital solutions. It's not just about convenience, it's about creating a healthcare system that's more accessible, more responsive, and yes, more human. But what does this surge in telehealth mean for patients and healthcare providers? Let's unpack the benefits. For starters, telehealth is tearing down geographical barriers. It's bringing expert medical care to remote corners of the world, ensuring that distance is no longer a deterrent to quality healthcare. And it's not just about reaching far-flung areas. Telehealth is redefining patient engagement and satisfaction. Imagine the convenience of managing your health from the comfort of your home, the ease of scheduling a consultation at a time that suits you. Virtual visits are not just appointments, they're a testament to how healthcare can be personalized, accommodating, and patient-centric. And as we discussed in episode 62 on patient experience, it's a way to wow your patients. But the benefits of telehealth extend beyond patient satisfaction. For healthcare providers, telehealth is synonymous with operational efficiency. It's about optimizing resource allocation, reducing overhead costs, and streamlining services. In a world where every second counts, telehealth is ensuring that healthcare isn't just high quality, but also high efficiency. As we navigate this digital healthcare landscape, it's clear that telehealth is more than a trend, it's a transformation. It's a shift that's not only making healthcare more accessible, but also reshaping the very dynamics of patient care and provider services. And while there are many benefits to telehealth and virtual visits, there are also challenges with reimbursement and what the future holds for this innovative model of healthcare. While telehealth has undoubtedly made healthcare more accessible and efficient, it brings its own set of challenges, particularly when it comes to reimbursement. Navigating the reimbursement landscape is like walking through a maze, with each turn presenting a new set of rules and obstacles. And that's on a good day. The current reimbursement models for telehealth are as varied as they are complex. From private insurance plans to Medicare and Medicaid, each has its own set of policies and rates, often differing significantly from state to state, insurer to insurer. This variability not only creates confusion, but also poses a significant barrier to the widespread adoption of telehealth services. But what are these barriers, you ask? For starters, there's the regulatory maze, a tangle of laws and guidelines that often restrict the full potential of telehealth. Then there's the issue of standardization, or rather, the lack of it. With each payer setting its own rules, healthcare providers find themselves constantly juggling different requirements, leading to inefficiencies and increased administrative burdens. So, how do we navigate these challenges? How do we ensure that telehealth doesn't just promise better healthcare, but also delivers financial viability? The answer lies in operational change and organization. If you are adopting telehealth as a central strategy, your team should research for you exactly how to document and bill for your visits for each of your major payers. These medical policies should now be fairly static, although you should keep your eyes and ears open for changes at both the state and payer level. Being successful with telehealth also requires workflows and staff who are trained to assist you in making this as streamlined as possible. Most groups schedule telehealth in blocks, so a clinician may have a designated half-day or whole day where they schedule telehealth visits. Your team will need to digitally room the patient and be available to assist with any patients having technical difficulties. This is a whole new skill set. We'll need to be ready for it, and we'll need to be patient with older people who aren't as familiar with the technology. And it's not just about waiting for change, it's about being part of it. Healthcare providers can adopt strategies to navigate the complex reimbursement landscape. Staying informed about policy changes, leveraging billing and coding expertise, and advocating for fair reimbursement, these are just some of the ways to ensure that telehealth can be both beneficial for patients and financially sustainable for clinicians. But what does the future hold for telehealth reimbursement? It's a future that's evolving, driven by technological advancements and a growing recognition of telehealth's value. We're looking at a future where reimbursement models are not just about compensating for services, but about promoting the best, most efficient, and most accessible healthcare solutions. As we look ahead, it's clear that telehealth is here to stay. It's not just a stopgap solution, but a fundamental shift in healthcare delivery. And with this shift comes the responsibility to ensure that telehealth is not just accessible and efficient, but also financially sustainable and rewarding for both patients and clinicians. So, as we wrap up this segment, let's reflect on the journey of telehealth. From humble beginnings to a cornerstone of modern healthcare, telehealth has proven its value, its necessity, and its potential. And as we continue to explore this digital frontier, one thing is certain: the doctor will indeed see you now, online. Join me for our next episode when we'll discuss the new innovations in patient payment systems. You can find more information online at medicalmoneymatterspodcast.com, and you can subscribe to the Medical Money Matters content website for physician leaders to find budget templates and many other tools. We've included those links in the show notes. As I like to close out these podcasts, congratulations on taking the next step in your professional development and for making the commitment to learn about the financial and business aspects of your practice. I look forward to being on this journey with you and send you my heartfelt gratitude for all that you do for your patients all day, every day.